Good evening and welcome everyone. Thanks for joining us today while we celebrate World Mental Health Day today. And we have our guest here, Dr. Sunil Mittal, who has been very generous in taking out his time for us to answer any question on mental health today. So thank you so much, Dr. Mittal. I'll start with actually introducing Warriors Connect, which is the community that is hosting this event. There are a few people who are not from our community in this meeting, so for their benefit. Warriors Connect is a community that enables people diagnosed with various mental health conditions and their family carers to get empathetic support by peers. So peers are the folks who have been dealing with similar situations and similar circumstances. I am the founder of Warriors Connect, and I'm very happy to share that we are now having 135 members almost in our community. We call them Warriors, and they connect to each other over chats, over weekly online huddles, sometimes in-person meets. And we also store our important conversations, our peer recommendations, and like original creativity, as I was saying, on our confidential online repository. So that's just a little something about us. Now coming to the two partnering organizations we have here, AMAHA and CIMBS. AMAHA is a leading mental health care provider which offers a wide range of psychiatrists and therapists for online as well as offline sessions. I think when I checked last, there were about 140 in-house mental healthcare professionals at AMAHA who were working across 15 languages or so. So AMAHA has been started by a psychiatrist, Dr. Amit Malik, and a caregiver, Neha Kirpal, who is a family carer for her mother with schizophrenia. And lately, Warriors Connect has started collaborating with AMAHA. They have offered our members a bit of a discount on their services, but I'm extremely thankful because they have let us use their Delhi and Bangalore center for our in-person meets. And we're looking forward to more such meets in the future. Coming to CIMBS or CIMBS, it stands for Cosmos Institute of Mental Health and Behavioral Sciences. It offers a professional and integrated system of psychiatric and psychological treatment through a very trained team of psychiatrists, clinical psychologists, and therapists. They provide outpatient care, hospitalization, residential care, emergency care, and they also have advanced specialties such as brain stimulation. And actually, CIMBS was founded and cultivated by a very senior, prominent psychiatrist who is none other than our guest for tonight, Dr. Sunil Mittal. Dr. Mittal, I'll just take 2 minutes to say something about you, maybe 1 minute only. Yeah. So Dr. Mittal has an overall experience of approximately 40 years. So we are really lucky to have him here today. Apart from a vast clinical experience of treating just about all mental health disorders, in various hospitals and clinics that he has been associated with. He has also been associated with various professional, social, and philanthropic organizations. Most notably, apart from founding CIMBS, he has also founded the Indian Association of Private Psychiatry. And he's also currently serving as the Vice President and Executive Committee member of the World Federation for Mental Health. And I must point out very interestingly that this global organization, World Federation for Mental Health, or WFMH, it was established way back in 1948. And it is them who coined 10th October as World Mental Health Day, which we are celebrating today. In fact, some of the members of Warriors Connect are also volunteering for WFMH's global campaign this year. So recently, Warriors Connect won an award. This was something that I shared with the members of Warriors Connect yesterday. So, the award says excellence in mental health care in India for being a peer support community. So it was really great to be recognized. This was actually awarded at the Global Mind Care Conclave that happened on 8th, which was hosted by Z Media and supported by Rotary, World Federation for Mental Health, CIMBS, and actually literally orchestrated by Dr. Sunil Mittal. And Dr. Sunil Mittal actually plans to take this international very soon. So there's a lot going on for us, and with the support of Dr. Mittal, I hope you'll charge ahead. He's been a mentor for me right from the very beginning, when I had just conceived the idea of Warriors Connect and had started doing some preliminary research on how to structure it and how to go about it. So I think we've come a long way from there, which is great. So Dr. Mittal, I have spoken too much, like I usually do. So I'd like to hand it over to you now. And just before we go to the whole question answer thing, would you like to please offer some opening remarks?
One, the peer support community Warriors Connect is the sort of community that's badly required. Well, that's one. Second is the fact that I get a chance to meet so many people online who have their own story about mental health or the difficulties they may have had and how they've been able to manage their lives or their family members' lives, and as well as the fact that this organization is your creation. So it's a triple joy to be here.
Thank you.
But then, of course, the organization is as good or as big and as effective as its members. And I think you've done brilliantly, the organization done brilliantly by having 135 members on board now. And you very well deserve this award, which you received on the 8th. Your organization deserves it. When the organization gets it, it's every member of the organization who gets this and gets a recognition. And as you mentioned, it was the World Federation for Mental Health that initiated the World Mental Health Day. And as you've given a little background, the World Federation for Mental Health was founded at the same time as the WHO. And it has advisory status with the UN. And it was in 1992 that the idea of a World Mental Health Day it had been in the offing, and 92 it was implemented, and 10th of October, it began in 1992. Is the WFMH that selects the theme every year. Then it's circulated. So 10 themes are shortlisted, circulated, one is selected, and then it goes to the WHO to pass around the world. And the theme this year has been mental health is a universal human right. And when it says that, it's not talking about the rights of people who may have a mental health condition. It's referring to each and every individual in this world. Is their human right? So each one of us has a right for our mental health to be protected and to attain the highest level of mental health and enjoy it in the context of whatever our culture, our country, and its economic situations may be, to have the highest level of mental health. And of course, having said that, there's a whole dimension of persons who live with mental health conditions, and their rights become definitely important. Mm-hmm. So rights include, if you go back to I'm sure each one of you here is aware, but being the World Mental Health Day, I'll just recollect for everyone that it was again in 1945 and 48, then the UN Declaration on Human Rights came out after the World War II and the gross violation of human rights during World War II. So, and that's when it became, whatever was being done in the Western world became right-centric, which has grown. And then 1966, there was this convention, UN convention on cultural, social, and economic rights. So it was actually the rights, social, economic, and cultural rights. The convention was there, so they became more codified. Forward to some other conventions for political and civil rights. And then 2006, when the UNCRPD, the UN Convention Rights of People with Disabilities, which included mental health disabilities, whether they are temporary or they are permanent, the disability that is. So India is both signed and ratified the UNCRPD. Ratification means that we will harmonize all our laws in accordance with the UNCRPD. And that's why the new Mental Health Care Act, which came out in 2017, was notified in 2018, is in harmony and in line with the UNCRPD. And it's an act of rights. It protects the rights of individuals who may be suffering from a mental health condition. The Indian Mental Health Care Act, one, it protects the rights, and the second, it has certain interesting features to it. For those who may not be aware, there are features like appointing a nominated representative. Persons who have a mental health disorder can appoint a nominated representative who can act on their behalf if they happen to fall ill and not have the capacity to make decisions at a particular moment. Otherwise, it is assumed everyone has a decision-making capacity intact. And of course, this is different from legal capacity. Here, we're only talking about capacity to make mental health care and treatment decisions. And one of the interesting features and one of the most advanced features of this act is the advance directives. It's like a living will. You can write a will that if I ever happen to fall mentally ill and I can't make decisions, so-and-so is my nominated representative, and I wish to be treated in a particular manner at a particular hospital, at a particular facility. And of course, two things. That firstly, that such an advanced directive requires to be registered with the mental health authority. And secondly, in the interest of the patient, at the behest of the nominated representative, treating psychiatrists may examine the patient and override the advanced directive if so required, but those reasons have to be strong enough. Now, this is about the act, but if you look at the overall situation of rights to mental health, the Constitution of India, Article 21, speaks about it is about the right to life and liberty. And the right to life subsumes the right to health as the courts have interpreted it. And of course, right to health means right to mental health as well. And the right to liberty is the one which can often be in a difficult, challenging situation for people who suffer from any mental health disorder, which at a point when they can't make their own mental health care and treatment decisions. Because when the Act makes a provision for them to be treated, then the treatment has to be what is referred to as a supported treatment in case they can't make their own decision, and the supported treatment, the decision maker becomes a nominated representative. So I'm not going into details, but that's where we are. I'm not going into the statistics for the Indian situation, but what needs to be emphasized is that mental health is one of the fields where users of services, or often referred to as consumers of services, have had a say in the matter. Whether they are in representations or in policy decisions, you don't have cardiac patients having a say in how a cardiac OPD or a cardiac surgery or a cardiac treatment should work. But users of these facilities and services, whether they are patients or their caregivers, have a say. So they are not just stakeholders, they are very active stakeholders. It becomes a position of responsibility. And that's why each one of you here is a very important person as far as the operations of the right to mental health for those who suffer any mental disorder, or drafting of any future laws and policies. And yes, organizations like Warriors Connect become more important since it's a community where everything is shared. The peer support is so important. And I was at Z Media today, where the conclave was hosted 2 days back, which was aired, televised today. And they have something called a town hall where they have an open discussion. And today the topic was mental health, as it had to be because of the World Mental Health Day. So we spoke about a buddy system with them. That people may not walk up to a psychiatrist or a counselor for help. But if they are buddies in office, like mentors, they are not there to mentor them just for their professional work, but they are buddies with whom they can confide and share. And that's much like a support group that you have, where you can share, help find solutions, and then, if so required, seek professional help. Now, I've spoken a long bit, but I thought it is only right to do so because it's the World Mental Health Day. And now Avani, like you said, ask me anything.
First question is about dealing with anxiety, Dr. Sunil Mittal. He is talking about this person who's a member is just saying, how should I deal with anxiety? I freak out when I'm in a large group, and the other person opposite me just wouldn't understand. Vamshi, if you could just mention as some context, it would be good. But otherwise, the question is about anxiety. And there is another question about anxiety. I'm just saying it at the same time because you might be able to answer it together, Dr. Mittal. Is it possible to not have a panic attack or anxiety attack in the future? Because I've already had 2 very bad panic attacks at certain situations. So I think this is the worry for the future.
Right. So if you talk about anxiety, let's remember this, that anxiety is a very normal, natural human response. Animal response for that matter. Even if you look at, if you have anybody has pets, they can look at their pets. Or even if you look at dogs in the street, when they meet each other, either they're friendly or they're very anxious. So it's an animal response. And to answer your question, I would need to go into a little bit of a background to why anxiety occurs. It may be repetitive, you may already be aware, but still it will probably benefit anyone here in this group who's not aware of what I'm going to say. Firstly, that anxiety is a normal response. Secondly, in the face of uncertainty, in the face of a novel experience, in the face of danger, in the face of an experience where we anticipate something to happen, anxiety is a defense mechanism. So first, let's accept that all of us feel anxious some time or the other. Some people feel more anxious, some people feel less anxious. The other reason for why people may feel less or more anxious is also to do with sometimes their body physiology. It may have to do with genetics. It may have to do with multiple factors which are beyond the control of that individual. When anxious, one has a fight or a flight response. I'm sure you've read of these terms. The moment you anticipate danger or perceive something untoward to happen, your body pours out a lot of hormones. The brain and the adrenal glands, they pour out hormones. Adrenaline, and other hormones as well. And in a split second, your body prepares to either run, fight, or flight. It's a split second response. To give an example, that if you're sitting in a car and you're traveling and you narrowly miss having an accident, what happens? It happens to me, it happens to you. Our heart skips a beat, the heart rate goes up, we start breathing rapidly, we start trembling, we may get goosebumps. If we get up, we may have a churning inside the pit of our stomach, we feel giddy, and we may have to rush to the toilet. Mm-hmm. So this is a very normal anxiety response. Now, this truck that I narrowly missed hitting is not wired to my heart. And it's just in that 1/10 of a second that this response is occurred, which is given by nature to survive. If I was sleeping in the same car, I probably will wake up, have a little racing heart, but nothing more than that, because I'm not aware of what has happened. So it's the awareness of danger, awareness of uncertainty, that creates fear, and a part of our brain called the amygdala becomes activated. That's where anxiety, fear, anger, other emotions arise. And before the, say, logic can set in, which comes from the frontal lobe, the front part of the brain, the amygdala hijacks a stimulus or a signal that is coming in, interprets it as danger, and you feel anxious and get a panic attack. It's like, say, if you're in a building and there is a fire alarm goes off, you'll rush. But if there was no fire and the fire alarm still went off, you'll still rush. So panic attack is like a false alarm. That happens. And like the participant has written, when they are in a large gathering and the anticipation is maybe people are looking at me, maybe people are judging me, and I've become self-conscious, and therefore anxiety comes in. The more anxious one feels, the more self-conscious one feels, but the more self-aware in terms of I may not say something wrong, I may be looking odd, perhaps I can't walk properly. Those sort of narrative starts in the brain, and therefore anxiety shows up further. Mm-hmm. So that's what happens in a panic attack or situational anxiety like this. And if you were to see a therapist, or you can help yourself by looking at certain videos or self-help manuals, which are you can access online. Or if you were to see a therapist, they would take you through a certain process of desensitization and being able to handle anxiety. And maybe, perhaps, even medicines may be prescribed, and they can certainly help.
Also, we got some associated questions that, we've been working from home all this while, lost interaction with people one-to-one. Now, when we're back there, you feel so anxious. We speak really fast. Other people can't understand me. People look at me in a kind of disgust. So this is again a manifestation of anxiety. And I think Dr. Mittal has also explained that how it happens. Very nice biological explanation he gave about the amygdala and the prefrontal cortex. And I think this does make us understand how it happens, and how we can relieve it is, I think, really good. We should go for therapy. Therapy would help a lot. And of course, drugs will too. But I think for a long-term solution, as Dr. Mittal is saying, getting mechanisms to therapy is way better than taking SOS medicines all the time. So there's a very specific question that has come to me, only me. It says, I had experienced severe and prolonged trauma in my childhood between ages 9 and 15. It took me over 3 decades to talk about this phase of my life for the first time. I then went to a psychiatrist who asked me to go through MCMI3 and Rorschach ink blot test. It showed borderline personality disorder, avoidant personality disorder, schizoid personality disorder, masochistic personality disorder, depression, anxiety, and PTSD. I actually numbed out and don't feel my emotions since then. In addition, I struggle with insomnia. Wanted to know from you on what I could do to feel my emotions again and then to get better sleep.
Okay, So I think let me answer this person's question in three different way. There are three different sub questions to this. The first is it has taken him or her more than a few decades to actually speak about it, but it's good that finally, let me just use she or a he. Finally, he is spoken about it. It's really good, because once you start sharing, once you open up, it's only then that help can be sought. And if you have experienced trauma, it's not your fault. If you have had a trauma, a prolonged trauma, you're certainly in no way to be blamed for it. And if there are consequences of it, there again, while we usually, when we say psychological, but there are biological consequences to it. Avani is a neuroscientist. So, she would help us all understand this. When one is exposed to prolonged trauma, again, it's a prolonged exposure to stress hormones, which wires our brain in a certain manner. Psychologically speaking, there is the trauma, the emotions, and then, of course, the body's own response to it. And I'm trying to simplify this, the term is neuroplasticity. But when the brain gets wired in a certain manner, every time you're in a situation which even as a shade of that trauma, then the same responses come up, because those brain circuits also code for memories. So your brain gets wired, you have certain memories, and any trigger of those brings up the same emotional responses, not necessarily the same thoughts. Psychologically, this was called that the emotions and the thought dissociate. And this feeling of numbness is one of dissociation. Now, having said that, the best way forward would be to obviously to seek professional help, like this member of the forum has done so. And when an exhaustive test is done, again, MCMI was done, what is coming up and are traits, whether they're emotional instability or depression or whatever, those are traits. Those are not diagnoses. So as a routine, when we conduct assessments in a clinical setting, it's not to diagnose, it's to look at traits. Unless, of course, the traits are so severe that it meets a diagnostic criteria. So a diagnosis is a separate matter. Just like getting, say, a high blood sugar on your blood test doesn't mean you're diabetic. There could be other reasons for it as well. But the most possible reason is diabetes. Getting one single recording of a blood pressure being high, it doesn't make you hypertensive. So a finding of this nature, where you have multiple things turning up, is indicative of traits. So you don't need to numb out on this. It's not saying that you, pardon me for putting it like this, that you're beyond treatment. It doesn't mean that at all. It doesn't mean that you are such a bad case. Not at all. All that it means is your therapist can use this information when they work with you. So I would suggest go back to the therapist, go back to the psychiatrist, discuss this report, or seek somebody else's opinion, and definitely do seek help, which is professional.
Okay. Thank you, Dr. Mittal. I do know a bit of the story behind this. Since this happened, our member has really put in a lot of effort from his own side, read a lot of things, did a lot of self-help, which is how he is kind of stable right now. I think the blunting of emotions that resulted from the initial circumstances is something that he's dealing with. But what I really liked from this is that these are traits, not diagnoses every time when we do these fill out whatever questionnaires, whether they're the proper ones that a therapist gives. There are all these things floating around online, which I would not recommend anyway. But
Certainly not. Certainly not. Please go to the standardized questionnaires and do not interpret it yourself, and never go to the WhatsApp university or the
except
online
our
university.
WhatsApp community, which does not talk about drugs. So
Yeah. So I mean, I'm not talking about our community. I'm
I
saying
know.
never go to a university which is online unless you're guided to it. Because there's, like you said, every sort of information floating around.
Yeah, right. I'll go on to one question which is very pertinent, I think, and it is asked in different contexts. So this person says, I'm dealing with schizoaffective disorder and work in research field. One of the psychiatrists told me that you can never be spiritual as it may lead to an episode. My question is that should we live as non-spiritual person so as to avoid future episodes? Primarily if my delusions have had my delusions had been highly spiritual. So, Dr. Mittal, the thing is that we have a disclaimer in our community about meditation. So, meditation overall, of course, is supposed to be great. It's good for neuroplasticity also, and overall, it makes everything better. However, since a lot of our members have schizophrenia, bipolar disorder, schizoaffective, etc., and have had experience of mania and psychosis, this is actually a trigger risk factor. We know of people who have been triggered into mania and psychosis due to certain forms of meditation. It could be like even pranic healing was one example. Art of living, Sudarshan Kriya was an example. Whereas other people swear by these things. There are a lot of people with bipolar disorder, and at least I know bipolar disorder, who do meditation very well and they thrive on it. So, what do psychiatrists say or don't say to people who have such conditions?
Right. So as a generic, there is a disclaimer, like what you said, as a generic, but each individual is different. So let me try and answer this question in a few ways. One, let's talk about spirituality first. Spirituality doesn't mean that only people who meditate are spiritual. Not at all. Or only people who are religious are spiritual. Not at all. You can be an atheist. You may not meditate, and you could still be very spiritual. So spiritual is believing in universal values of love, compassion, being humane, kindness, living in harmony. That's what spirituality is about. So it in no way means that people, I repeat this, that you can get spirituality or attain spiritual heights by meditating. It may help individuals, that is, meditation may help individuals who are restless, who are otherwise, I'm not talking about somebody living with schizophrenia, schizoaffective disorder, bipolar disorder, or some other mental disorder. But people who do not have a diagnosable disorder, it may help some of them, or quite a few of them, to calm down their mind, to use a later. But then when you meditate, brain, psychologically speaking, one regresses. Physiologically speaking, there are some physiological changes that take place, which can trigger a fresh episode of bipolar or schizoaffective nature, or even worsen the psychosis. And that's why, as a rule, psychiatrists do not meditate. But I would not say that don't be spiritual. You can be spiritual. It's just like what Avani was saying, that some people can meditate and some people may not be able to do so without a risk attached to it. It's like saying that, well, somebody can eat soya beans or rajma, and some people cannot because they can't digest it. Or some people can take milk, and people with lactose efficiency will not be able to digest milk. So if it is not for you, it is not for you. Also, let's look at something else. Even in people who do not have a mental health condition, mental disorder, when people have to learn meditation, they're expected to go to a guru. I'm not talking about large factories churning out people in mass, learning meditation. But a good guru is supposed to recognize the fact and say, and tell you, abhi nahi hai, tumhare liye nahi hai. Because the guru is supposed to make out that this is going to work for you or it's not going to work for you. And I would believe that when people who have, at least in the Indian school of different schools of meditation, कुंडलिनी योग, तो वो कहते हैं कि कुंडलिनी जाग गई, and some people can, कि वो कुंडलिनी का फोर्स आप अगर उसको कंट्रोल कर सकते हैं तो you become superhuman. If you can't control it, it can drive you mad. Probably they're talking about individuals for whom they shouldn't have meditated in the first place. And if they did so, they had an episode, and the language used by the gurus, philosophers, was that they could not control the force of the Kundalini. So by all means, be spiritual. You don't need to meditate for that.
Okay. Thank you, Dr. Mittal. I would like to say, just to add to that, I know of people who have gone for Vipassana and these kind of very hardcore meditation retreats. But because of stigma or whatever, they do not disclose that they have mental health condition. They don't tell that I have bipolar disorder or schizophrenia. So I think the first thing we ought to do is at least share that with whoever, whoever is in charge, the supervisor or guru or whoever.
It's extremely important. Avni, years ago, I used to be a psychiatrist that used to get attached to, this group communication workshops. So this used to be earlier, about 40 years back, used to be called ARAD Seminar Therapy, EST, the person in the US who set this up. Of course, it's a business enterprise. And they have this intensive seminar where you can't even go to the toilet till your therapist or the person who's conducting it allows you to do so. And the idea is that it's so intensive, it makes you speak about yourself and that you regress. And there are some people who may have a psychotic episode because they went there in the first place because they were looking for answers or seeking help. And they probably didn't disclose that they had a history of a psychiatric disorder. And one would see people who had acute psychotic episodes or other episodes after attending such a workshop. And like you said, that disclosure becomes important and people may not do it.
Right. But Dr. Mittal, why don't psychiatrists just give this as a disclaimer when the diagnosis of bipolar, schizophrenia, schizoaffective is made? Because most people, for them, it's new news that what is meditation bad? Why isn't just a given like a...
I know. But I would feel, well, it has, it makes me reflect on the fact that when I diagnose what is all the information that I hand out, but suddenly noted, I'll try and do that.
Okay.
Because it's an important bit.
Right. Okay, thank you. Dr. Mittal, now there are two people who are stable at the moment, but are thinking about the future, right? One person is a male in mid-20s and is losing hair because in the year 21, 22, he completely stopped going out of the house, stopped doing activities that he enjoyed. So, deep depression, I'm guessing. I am better now since I started hair fall medication. So this must have also, triggered. I am scared if it comes back. So how does one know that they should visit a therapist or psychologist? So this is like anticipating the next one, when to know, when to go the next time and where to go. There is another person who is living with bipolar type 1 disorder and he's been stable since 3 years. And is it good to be on maintenance dose for a lifetime, or can we stop meds after certain years of disability of stability by tapering meds? I don't mind taking meds lifelong also, but it's like a question.
Right. So the first question on hair fall. The reasons for hair fall can be many, many. So they could be genetic, they could be hormonal, they could be infection, they could be some systemic infections. Say people have lost hair after COVID. So first, of course, those the reason should be determined, and if you're taking medication with which some of your hair has come back, I would assume that you may require to take it for a long period. And if they do happen to fall again, what I would suggest, which is something which people would have told you anyway, is do not be, let's say, let's not anticipate, let's not fear something which has not come yet. So always keep telling yourself, look, in future, when in future. The second is that, yes, for all of us, our looks, hair are extremely important. If I may share, my hair started turning gray when I was 20 years old. So I got strands of gray hair. It bothered me. Then I started talking to myself, what the heck? There was a time when if I saw gray hair, I would pluck it out. And then soon I realized if I'm going to pluck out my gray hair, I'm going to pluck out more hair than, by mid-30s, I had more, or 40, I had more gray hair than black. So the only thing is to accept it. And in accepting it, what I told myself is that I will not attach my self-esteem to the color of my hair. Even if my hair goes away, I'm still Sunil. I'm not changing. Right? So I guess you need to use similar strategies. But if the anxiety persists, then do see a therapist or a psychiatrist.
Okay, so
second question. Yeah. Yes, please.
He did mention basically that how would he know when to visit a therapist or a psychologist?
If it is bothering you too much, if it is a recurring thought that you have, if it is coming in way of your quality of life, if it is, I'm trying not to use a technical term, like if it's an obsession, and I'm not diagnosing OCD, but if it's an obsessive thought, if it is taking away from your normal socializing and pleasure, it's a good idea to talk to a therapist.
Right. Yes, sir. So the second question was, person instability, wondering whether the drugs can be tapered off eventually. Will they be, or will I be on lifelong meds?
Right. So again, everybody's bipolar is different. They're not the same. Bipolar disorder is a group of disorders. Even if it's type 1, we still believe that probably there are multiple reasons, and no, they're not, at least there are, even in type 1, there may be 3, 4, 5 different subcategories. Right. So how frequently the episodes have been occurring, how severe they have been, are there any other comorbid or other health conditions? All those things matter. But as a rule of thumb, that if you have had multiple episodes, then it's a good idea to continue your medication, even if it is for a lifetime. And I'm sure you've heard it. You don't want me to repeat it. You don't need me to repeat it. Even diabetics will take it. People with thyroid will take it. People with other health conditions, hypertensives, will take it. And we've got to make peace with it. And like you have said, that you don't mind taking medication. You have accepted the fact that you require medication. It does you good. then I would suggest go on taking medication and speak with your psychiatrist after, if you've been stable for 5 years, speak with your psychiatrist if it would be worth taking a risk to decrease or taper off very gradually your medication. It'll also depend at what point of life you're attempting to do so. If you're working and you're doing well, would you like to disrupt that? If you are due for a promotion, is that the right time to go and look at a change in medication? Somebody it's time to get married or whatever other reason. So the place and time for that particular individual, the health conditions, the frequency and severity of episodes that have been, please discuss with your treating psychiatrist and then make a decision. But there's no harm in continuing medication, even if it be for a lifetime. I have patients who are bipolar disorder, whom I've been seeing for the last 40 years, who are on medication. And 40 years is pretty much a lifetime.
Yes. Okay. Thanks for that, Dr. Mittal. Surely puts things in perspective for a lot of us, I'm sure. Dr. Mittal, a couple of our members have asked something about a particular drug and associated side effects. Typically, in Warriors Connect, we do not encourage discussions of this sort because people tend to compare their medication, and it can lead to indirectly it could lead to somebody thinking about non-compliance. However, we are here in the midst of a psychiatrist, so I'm wondering maybe we can take a couple of those questions. What do you think, sir?
Surely.
Okay. So there is one question that can lithium cause muscle weakness even if it is in the therapeutic range? I have shrinkage and expansion of muscles all over my body. Like the muscle on the entire body shrinks a little bit when hungry and expands after eating food. You ever not heard of this? So just thought I'll ask.
I really can't answer that one.
Okay.
About the shrinking and expansion of muscles. But lithium can impact. See, lithium, for those of us who have studied chemistry, lithium is close to sodium in the periodic table of elements. It's a metal, and lithium carbonate is a salt. It tends to replace sodium in different parts of the body. At cellular level, there is a sodium pump, and for the transmission of nerve signals, ions like sodium become important. So lithium can cause tremor. Lithium can cause sometimes easy muscle fatigue, but these are rare side effects. It shouldn't put anybody off lithium. So if you have been doing well on lithium, unless this is a side effect which is we are sure is because of lithium, one, or if it's causing any sort of disability, I would suggest to continue with the medication, even if it's in the therapeutic range. That even if it's in the therapeutic range, you can discuss with your psychiatrist that would she or he consider looking at a level about if it's a 0.7, 0.65, but that decision has to be that psychiatrist. And please do not go off your medication.
Right.
If you have been stable on medication, do not experiment by going off. This is for everybody.
Right. Central guideline.
Yes.
Right. Okay. Dr. Mittal, one more medicine-related question was that this is a patient of schizophrenia who is on clozapine 100 and Resicart Forte 3 pills a day. And she learned that these medications can cause blurred vision. So she's planning to visit an ophthalmologist. Is it something to do basically, to do with vision and ophthalmology?
Okay. Firstly, blurred vision can be due to different reasons. So do visit an ophthalmologist. Get an eye checkup done. Say, I don't know your age, but if you're 40 or more, maybe there's a change in the diffraction. You may require glasses for reading. That may be the reason for blurring. If you're younger, then there could be other reasons as well. So do see an ophthalmologist. That's the first thing. The second is, before you see see an ophthalmologist, discuss this with your psychiatrist. Does your psychiatrist feel that this could be a possible side effect of medication? And the third thing is, yes, psychiatric medications, some of them may cause blurring of vision, which is not necessarily permanent. The most common thing that we see is that due to psychiatric medication, due to an effect of these medications, which is referred to as the anticholinergic effect. In our eyes, when you're reading or when you're looking at a distant object, the pupil dilates or contracts to change the shape of the lens to be able to focus. But if the pupillary response is slowed down due to the anticholinergic effect of medication, there can be blurring of vision. But some medications, whether these or others, or even physical conditions like hypertension, diabetes, or cataract that may be developing, could result in blurred vision. So my advice would be, see an ophthalmologist, discuss this with your psychiatrist, and then decide what needs to be done. But if it's an irritating side effect, which can be corrected by wearing glasses, and it is not indicative of something serious, then I would not see any reason to change medication. If it's suiting you and it's making you, it has taken care of your psychiatric illness. Let's remember one thing. There is no medicine without a side effect. Something which does not have a side effect does not have an effect. A side effect means an effect we don't want. Let me take up the example of aspirin. Aspirin was used as a painkiller. Aspirin was used to bring down fever. But one of the side effects was that it reduces platelets. It's an antiplatelet. That is a side effect when you're treating, say, fever. And that's why you don't want to give it to somebody who may have a viral or a dengue, because that will reduce platelet count. But this side effect is used in cardiology and neurology. You use aspirin as a blood thinner, and that's the effect you want. And that's where the side effect is actually the effect that you desire. Right? So what one needs to be worried about is, there are serious adverse effects because of medication, serious side effects. And that your doctor can guide you best.
Okay, so these are members who have asked their therapists about this. However, they would like a psychiatrist's opinion. Okay, so one is that when we are in a stressful situation and need to take a decision, what do we do? I am told in therapy not to take a decision when under stress, and hence my question.
Okay, so the question is, do I make a decision which is critical when under stress? Have I got the question right?
A decision. It is not critical decision, just a decision, because Dr. Mittal, taking any decision is very difficult, right? When you are clouded thinking.
See, I think as a principle, one shouldn't make at least critical or life-defining decisions when one is stressed. Now, when you're stressed out, you don't go and hand in your resignation. When you're stressed out, you don't want to break off from your partner. When you're stressed out, you don't want to not appear in an exam or an interview. Those are critical decisions. But yes, on the other hand, if you're stressed, and some of the critical decisions you need to make there and then. If you're driving and you're stressed and you need to make a critical decision whether you want to be driving any further, or whether you want to which route to take, whether you want to avoid, what speed you want to go at. Those are decisions that you make even when you're stressed. But yes, if you feel ever that the stress comes in your way and you will regret your decision, then wait till the stress is over. but the stress is chronic, or it's a decision regarding an action plan that might likely reduce the stress, then you have to go ahead with it.
Right.
And a good idea would be to bounce it off your therapist, because therapists can say, and usually some of the rules of therapy can be that making major decisions should be done in consultation with a therapist. You know, these don't relate to everyday small decisions.
Okay. So the second question related to something that a therapist could not answer or they're not satisfied was that I've been diagnosed with clinical psychotic depression in 2013, and because of one psychotic episode, and she was told it was psychosis, and she later started therapy. She was able to unpack the trauma. The therapy helped, and she has identified some patterns. She's got closure from therapy, and she started group therapy also, which is moderated by a psychotherapist for self-care. But sometimes all this seems very exhausting. I want to ask, is it necessary to talk about the problem repeatedly for the impact of trauma to wane?
Difficult to answer in a generic manner. Yeah, because let me ask a couple of questions, and the individual doesn't need to answer. The person doesn't need to answer. But let's try and put in a question answer format for understanding. Is is participating in group therapy relieving your anxiety or depression in some way? If it is not, you may question your decision if you've been through some certain number of, let's say, sessions or meetings. Is participation in or is continuing with psychotherapy sessions I'm trying to use words which are not in any way is attending those psychotherapy sessions getting you nowhere? Then you may need to discuss this with your therapist or seek some other therapist, because it's all right. I may not have all the skills as a therapist. There could be somebody else who's got a different set of skills. And let me remind you and myself that I cannot treat everybody. You know, I can treat some and somebody else can treat some. So matching the skills, matching the therapist and the patient or the client becomes an important aspect. You also have this question regarding, a part of this, your question is that you were diagnosed with clinical psychotic depression, right? Because of one psychotic episode. Now, if you've never had another episode of depression, or if you have never had any other psychotic episode, and you're living an absolutely fine life, well, you may decide not to go for further therapy. Because see, for any therapist, it's also important to know when to terminate therapy. And in terminating therapy, on how to wind up therapy. So that's an important decision which the therapist must make. But if you want to be in a group for support, like here, this community provides you support, that's all right. But if you find that this group is going to be an impediment, then that's not all right. Not for you.
Yes, Dr. Mittal, about therapy actually being discontinued, not discontinued, like just finished in the right way. Many people are under the impression that, having long-term therapy to help you move through life in general with, all the obstacles that we face, that sort of therapy is a good idea. I mean, that is the kind of therapy I do, right? Because I don't have a past trauma that I'm trying to unpack, at least not something major. But when it comes to trauma therapy, I think that is different, right? It's different from.
Yep.
And Dr. Mittal, there were more things about interpersonal problems, between married couple. It's extremely tricky, right? To circumvent all of that, and not everyone is able to go to therapy or has experienced therapists nearby or is able to afford therapy. So, do you think we can ask something which is about a marital issue?
Please go ahead.
Right. So I'm living with bipolar disorder. I'm working as a manager in the government bank. My wife doesn't support me and always quarrels with me at times on various personal life situations. This worsens my illness. She also tells me again and again that I am mentally ill and I am on medicines and I am of no use. What should I do in such a situation?
Please take your wife to your treating psychiatrist for a good psychoeducation session. She probably feels distressed. She probably does not understand your disorder. She definitely holds you responsible for it in some way. And that's why her anger. And what we all may need to help her understand is that one can be angry at the disorder, but one can't be angry at the individual. Nobody invites any illness on themselves. Nobody invites any disorder on themselves. Forget a bipolar or mental disorder. Nobody invites even COVID or a viral fever or malaria or a gastroenteritis on themselves. Nobody wants to do that. And if it's happened, it's not because of the person's failure. It's not because of the person's mental weakness. And this is a dialogue which your doctor must have with your wife. And if your wife still doesn't understand, maybe then help her get introduced to a caregiver support community. Something which you can look at.
Yeah.
So for somebody who can, the other family members who have gone through the same phase, and they can help her understand that yes, bipolar disorders are real. They can cause difficulties in life. They can cause difficulties in relationships. They can cause difficulty in your work efficiency. But yes, they're like any other disorder, and they require treatment. And then it's a caregiver's responsibility as well to be involved with this process. So she reflects a caregiver's not being able to understand, a caregiver's either stress or a caregiver's denial, or broadly speaking, the burden of caregiving.
Right. Yes, we are all here to support each other and support your family carers too. We have a caregivers only subgroup. And if nothing else, then they can just apply to join Warriors Connect. At least I will have one conversation. At least that one conversation, maybe I can connect them to other caregiver groups that I know about. So I do usually say this to all caregivers when I meet them. There are some questions, very like particular ones, ki what job will suit a person with schizoaffective disorder? Can a person with schizophrenia get married? That one I've said it's too subjective. But yeah,
for that matter, that's a question where anybody can get married. Should everybody get married? That's another question. People who don't have disorders sometimes don't make very good spouses, and people sometimes who have got disorders make very good spouses. It's very subjective, yes.
Okay. And even the job choices for people with various mental health conditions.
So, okay, let me just inform you here. See, the job choices are again very specific. The skill sets, let's say, for lack of a better word, the degree of disability that a person experiences because of mental illness. Is it temporary? Is it permanent? Job can bring its own stress, even if you're stable. The job can also create a good environment for somebody. So this is very specific. But yes, there are uh, one of my friends, another psychiatrist, worked with the government of India. He was a government psychiatrist, identifying disorders for which reservations could be made, and also jobs of categories in which reservations could be made for people living with mental disability arising out of mental disorders.
Yes, but for
So
that
they
we
were
have
able
to match that criteria of disability,
match it.
more than 40%.
Let me also tell you one thing. There was a very interesting court decision. I think it came from the Supreme Court last year, sometime, where in a medical examination, a candidate was rejected from being appointed as a judge.
Yes.
And the Supreme Court ruled that such a disqualification was illegal. And even if the person had a bipolar disorder, and there are inter-episode periods where the person is absolutely fine, then one could not reject his appointment as a judge, which says a lot. Such judgment is really powerful judgment. So having said this, this is again going back to very specific situations.
Because
Thank you, Avni. It'll be a pleasure for me to come back whenever you invite me.
yes,
Or have one of my team members come and attend your forum, your meetings.
sure.
It's an honor to be here.
Thank you so much, Dr. Mittal. Really, it's a privilege to have you here. And we've been getting messages on the chat that has been a great session, powerful session, interesting. Thank you to Dr. Sunil Mittal. So, yes.
Thank you, everyone here. It's I don't know you individually, but it's a pleasure meeting you here as a group. And like I said, it'll be a pleasure for me to be back whenever Avani wants me back here. Thank you.
Okay. Sure, sir. Okay.
Okay. Good night, everyone.
Good night.